And it's so important to incorporate resilient skill-building activities into school curricula, into teacher strategies and teacher training, and into continuing education for professionals and employees. If there's no consistent effort to do that, then the results will similarly be inconsistent. What are the roles of mental health professionals in fostering resilience? We alluded to that before, about some of the things that mental health professionals know how to do and know how to do well that are connected to resilience building. But it's so important for mental health professionals who are providing direct services to individuals who are at risk, whether they've been traumatized or whether they haven't, to incorporate resilient skill building into every one of their professional contacts. One might puzzle for a moment about how one would do that, but think about how professional contacts for mental health professionals typically go. They typically involve some attempt to improve the individual's self-esteem, some attempt to improve their problem-solving skills, some attempt to help them learn interpersonal skills that will broaden and strengthen their social networks, and so forth. So those resilient skill-building efforts are common in professional interactions, and it's crucial for us to make them ubiquitous in professional interactions. It's important also for mental health professionals to be a part of the design and implementation of school or workplace-wide skill-building programs and programs that foster resilience in the workplace and at school. That's what school psychologists hopefully are trained to do in schools. That's what clinical psychologists are trained to do in communities. That's what I&O psychologists are trained to do in industries, hopefully. And education is an important part of that process. Educating families, staff members, teachers, supervisors, co-workers on their roles in building resilience. And everyone has a role, from the custodians to the administrators, from the people who have less interaction with customers and workers and students and so forth, to those who have the most interaction, from those who have the least power to change the system to those who have the greatest power to change the system. All of them play an important role in resilience building, and even those who have the least power and the least interaction can become that caring, responsible, non-abusive, supportive, consistent adult who makes a difference in a child's life or an adolescent's life or even in a young adult's life on the job. The ultimate lack of resilience is suicide or suicide attempt. And it's important not only for mental health professionals, but for everyone who's involved in interpersonal interactions to know something to do to help prevent those breakdowns in resilience and problem solving that lead to destructive consequences like suicide attempts. It's important not to be afraid to ask about whether a person is feeling suicidal, whether they're feeling overwhelmed, whether they're incapable of coping or feeling that they're incapable of coping. And it's important also to realize that such questions do not give people ideas. Over the course of my more than 25 years of private practice, nearly 30 years now, I've asked thousands of people, from young children to elderly adults, if they have thoughts about suicide or about hurting themselves, if they have the intent, if they have plans, and I've done suicidal risk evaluations for many of them. Most of the time, if I ask, people say, no, why would you ask? Sometimes when I ask, people say, yes, I have Thank you for asking. I'm glad you care. But in those nearly 30 years of interacting with people and asking those questions, not once, not one single time have I ever had anyone say, "Wow, what a good idea. Why didn't I think of that?" That's not the way people function. We don't put ideas in their heads about suicide and about destructive problem solving. If they're not there already, they'll say, "No, I'm not interested." If they are there already, they will be, in general, grateful that you've asked. It's important also to teach families, staff members, coworkers, and other responsible adults how to ask directly. Parents need to know how to ask their children directly, "Have you thought about hurting yourself?" So many parents are afraid to ask that question. So many friends and coworkers are afraid to ask that question. They're afraid that they won't know what to do if they get a positive answer. And many times the question is asked in such a way that it's almost impossible to get a positive answer. Like, "You haven't thought about hurting yourself, have you?" That's not effective. And so it's important for us to expand our influence as mental health practitioners to people in the community who can ask and then ask in appropriate ways and know what to do once they've asked and received a positive response. It's important for us to tell them to break the code of silence, not to promise to keep that private or confidential, and to tell somebody who has the skill and training necessary to intervene effectively. Teach children and friends how and whom to tell, so that they don't keep those kinds of issues private. Most people who attempt suicide and who complete suicide have told someone. Very often it's a close friend, a colleague, a coworker, even a healthcare professional in the days or hours prior to a suicide attempt that they were planning to attempt. And most of the time, those people did not do anything effective to try to stop it. It's so important for us to educate. And it's so important for us as mental health professionals to know how and where people can get help, and how and to whom lay people in the community can refer for help when they need it, when they have encountered someone who might be considering suicide. That's the ultimate lack of resilience. So how can you help as an individual? There are several steps that you can take. It's really important to know the data about suicide and suicide prevention, and to know the risk factors as well as the protective factors, so that we can help to reduce risk factors and help to strengthen the protective ones. We should know the warning signs, and we should educate others, trainees, teachers, staff, parents, students, coworkers, any others that we can get to be interested, so that we can reduce the stigma and the fear, and so that we can help them know what to do. If you are involved in a workplace or in a school or whatever organization, encourage that organization to and help them develop a systematic suicide prevention, intervention, and postvention plan. Put that in place and try to ensure that they use it. And you don't have to reinvent the wheel. There are lots of them available at some of the resources that I've listed, and online under suicide prevention, and on the website of the American Association of Suicidology. It's important to conduct routine risk assessments in whatever venue you happen to work. If you are in private practice, you should ask every client on a regular basis, have you thought about suicide? Have you thought about harming yourself? And then do a more comprehensive suicide risk assessment if they acknowledge the thoughts, the ideation, the intent. It's important to know the urgent danger signals, those things that would indicate that the person cannot be left alone. And it's so important to know what to do in the case of that kind of risk, or any level of risk of suicidality or of destructive problem solving. And then the most important thing, once you know, is to do it, to take action, to make it effective, to make sure that you don't ignore it the way that, unfortunately, some professionals have a tendency to do because of their own countertransference, because of their own fears, because of their own past history, because of their own concerns. I'd like to share with you a document that's called the Grieving Child's Bill of Rights. Children are especially vulnerable, particularly in the face of adult vulnerability and overreactions, to grieving, to a sense of loss, to senses of hopelessness and helplessness. Alan Wolfelt, a psychologist, developed this Grieving Child's Bill of Rights, and I think that it says a lot to us as helping professionals about what we can do and what we can allow kids to do to facilitate their own grief process. The Grieving Child's Bill of Rights. I have a right to have my own unique feelings about the death, trauma, or loss. I have the right to talk about the grief whenever I feel like talking about it, and hopefully to whomever I feel like talking about it. I have the right to show my feelings of grief in my own way, and my way may be unique as long as it's not destructive. I have the right to need other people to help me with my grief, especially grown-ups who care about me, my caretakers, my family, my friends. I have the right to get upset about normal, everyday problems in the face of grieving, because that's what kids do. I have the right to have grief bursts, that is, outbursts of emotion that may be unexpected or unanticipated, but that help me to heal. I have the right to use my spiritual feelings and beliefs, whatever they may be, to help me to cope with my feelings of grief and to facilitate that healing process. I have the right to figure out or to try to figure out why the person or persons that I love died or was or were lost or was or were hurt. I have the right to try to make some sense of the traumas that have occurred to me. I have the right to think and to talk about the memories of the person who died or was lost, and the right to expect that adults who care about me will at least allow me to do that. I have the right to move toward and to feel my grief and, over time, to heal from that grief, so that I become a whole, functional, stronger person as a result of it. On the screen now, you'll see a list of resources and references about grief, trauma, resilience, and healing. These are by no means exhaustive or all-encompassing. There are many, many more. I've alluded to several in the course of this presentation, and I hope that you'll find these helpful, useful to you, and beneficial. And a parting comment, that is, resilience can be taught and learned, and therefore you can foster it. You're important, and you make a difference. Thank you for your attention.